My name is Sabrina Merlo. Hi, Chad. I'm from Open Source Medical Supplies. Open Source Medical Supplies works to elevate the work that people are doing around the world to solve some of this PPE crisis in terms of the breakdown of the supply chain of PPE in response to the COVID-19 pandemic. And so we're supporting local groups on the ground doing production, as well as pushing out and supporting and celebrating designs developed in the open source community for PPE and medical supplies. And today we're having a conversation actually about the distribution end of PPE. And we're asking the question to both our esteemed panelists and to you, the community out there in the audience, what are strategies for equitable distribution of PPE? How do we ensure that, how do we think about community-based actions that can drive a more equitable distribution of healthcare supplies in this epidemic? And we have some people on this panel that are both experts in seeing the demand data and what is being asked for out there and where the needs are, as well as community organizers and makers who are serving those needs in terms of driving and developing production. And so I'm really looking forward to this conversation. I really appreciate our panelists, and I think we'll just go ahead and get into it. To the audience, our request is that we really want to engage you guys in terms of your questions and your ideas, your thoughts, your resources. Please leverage the chat for sharing, but also push your questions into the Q&A part. Sometimes they get mixed up. Let's try to use the Q&A for the questions, and then I will be watching them and pushing them out into our panel discussion. Why don't we start with some introductions? Rachel, maybe you could start and go ahead and share.
Absolutely. My name is Rachel Sad, but I'm better known as Crafty in making and art communities. I am an Oakland-based artist specializing in interactive public art. I'm also the executive director at Ace Makerspace, a 10-year-old nonprofit. And my engagement with COVID harm reduction projects is being involved in 4 production projects locally, 2 projects nationally as a consultant, and one of those local projects is actually something that I lead and is turning into an evergreen PPE production in Ace Makerspace.
Excellent. Jackie.
Hello, my name is Jackie. I'm here with Joanna representing GetUsPPE. It's a national nonprofit working on getting PPE donations to frontline workers. And it started out as a grassroots movement, actually. And it started out as a hashtag GetUsPPE from doctors and nurses on the front line of the COVID pandemic, to mobilize PPE supplies to the healthcare workers as soon as possible. So a bunch of local affiliates who are doing the same thing kind of jumped on this together and mobilized ourselves. So we've been doing this since about February. And now our work has grown to national scale, and we're reaching communities across the country. And we have all kinds of volunteers, including healthcare workers and public health researchers and engineers, programmers, and really passionate volunteers that we're lucky to have. And what we've been working on is working with local on-the-ground affiliates to make those deliveries of PPE happen, and also to scale some of the efforts that we're doing at the national level to better help the deliveries at the local level.
Joanna, do you want to follow on to that?
I was muted. Sorry about that. No, Jackie covered it. It's, I think it's a big part of the story is that there were lots of organizations that were working on this, small groups that arose as, people acknowledging the need for PPE, and GetUsPPE really just kind of pulled everyone under the same umbrella, and became a national organization.
And Joanna, what's your role with GetUsPPE?
Oh, I am a co-lead for the equity team along with Jackie.
Okay, and has the equity team been part of GetUsPPE from the origins, or was that like a later on evolution?
The equity
Yeah.
Yeah, it started in March, so it's been a part of the efforts. There's been a lot of challenges just in scaling our operations to meet the incredible demand that was happening. So that really took priority for a while, but in the background, we were still making and setting up the groundwork for through the equity team. So I also serve as the co-lead for the equity team at GetUsPPE. And Joanna and I are both with public health epidemiology background.
Excellent. Thank you guys for joining. And Demetrius, maybe you could tell us a little bit about yourself and your work in this COVID crisis.
Absolutely. I'm very happy to be here. I'm Demetrius Norman, president and founding member of the Northwest Louisiana Makerspace here in Shreveport, Louisiana. And so Open Source Medical Supplies, the group, kind of came at a perfect time when we were searching for a way to make the things that we do and the projects we work on more in line, I think, with social justice and social impact, as opposed to kind of the hobby status that makerspaces kind of take. Most of my founding members are very passionate community people, and we were already in the outreach. I've also founded my neighborhood association in the low income neighborhood I grew up in Queensboro, in Shreveport. And so I already knew I wanted to take an active role in what was going on when the pandemic kind of broke out and, you know, everything started shutting down. And so really getting to join the Facebook group, I didn't even really know a whole lot of what it was about. You know, I'm a tinkerer, so, you know, I just saw opportunities. Somebody's got some designs and we can make PPE. And without a whole lot of question or thought, I just kind of jumped in and, you know, jumped in with a lot of my people here in Shreveport. So we had a lot of grassroots effort with people actually using those free design files from the internet to make both the fabric mask and the shields, also without even really knowing the background about the open source community, the maker community. I, of course, knew that background and had researched a lot of that and have even written it into some of our small grants that we've started to get, how we would be able to use like open source tools to impact disadvantaged communities. And so this effort, you know, and even what we're talking about today was kind of like right on time, because I had actually just secured a couple of small grants and sponsorships from like AT&T and our Committee of 100, the Beard Foundation, and a lot of movers and shakers here in Shreveport, saying that we were going to be able to do, you know, what somehow we ended up doing a few months later with the PPE effort, you know, and with the open source medical supplies movement. So I didn't know it was going to happen or this would be an organization a few months later, but during the fall, I was just like, I just felt like I had to get ready for something. And so fast forward a few months later, you know, we were sponsoring people sewing masks. We were 3D printing shields. I really wasn't, I couldn't make heads or tails of it, but it was more like a battlefield kind of thing. So we were excited. And, you know, this is what we joined the Makerspace for and why we started our organization. This is probably the happiest. It's a bit bittersweet because we don't like the circumstances, but, you know, all of my members, I think we're closer than we've been since we started the organization through all of this. And we really feel like everything we do when we come to the Makerspace is actually a benefit and an asset to our community. So again, very excited to be here and to be talking about this subject. We're an active part of the Shreveport-Bossier African American Chamber of Commerce that's actually been working with us and partnering with us. Some of the partners have also been our sponsor. Like I mentioned, Committee 100, Griggs Enterprise, which Mr. Griggs owns about 9 of our local McDonald's here in Shreveport. So he's a Black entrepreneur, very successful business owner that sponsors our Maker Fair that we're the licensed host of. And so some of our sponsors have gotten together and also raised money to donate body cams and, you know, kind of everything that's going on right now. We have like this mixture and this mashup working together. We've been donating the shields to SPD. Very exciting topic. So happy to be here.
Yeah. That it's been an amazing moment for the maker community as a kind of as a response to 15 years of building the network and building the infrastructure of these spaces. I wanted to share, and I was just going to post this to the group through the chat, is this is a definition of equity from the World Health Organization. Equity is the absence of unavoidable, unfair, or remediable differences among groups of people, whether those groups are defined socially, economically, demographically, or geographically, or by other means of stratification. Health equity or equity in health implies that ideally everyone should have a fair opportunity to attain their full potential, and that no one should be disadvantaged from achieving this potential. But I was, you know, just a respected institution in this landscape. And to that end, that the maker response around providing PPE to some extent has been a reaction to the natural network of these spaces and of these people, like how people discover. I mean, there have definitely been proactive efforts of building relationships with people in medical and in the social services communities, but there is some element of like natural networks playing out. And I wondered if either Joanna or Jackie could share some of the information they discovered at GetUsPPE around the demand, the demand data. Who is asking for PPE? Who needs PPE, and how do we know about them? And you guys did some analysis around the data that you've been seeing. You guys are probably the biggest site in terms of SEO, or where people are posting what they need. I need face shields, I need masks, I need gowns. So could you tell us, just bring us up to date with what you saw in that data and what the equity implications are?
Sure. Jackie, how about I pull up those slides? So quick screen share. Oh. Here we go. Can everyone see that?
Yep.
Great. So this is some of the data that we have that we were able to present for you guys. So as you've mentioned, we've been collecting a lot of data from PPE requests across the country, but of course, like, we are concerned about areas and populations and facility types that we might be missing. So this is a map of the US. We've got median income by county, and blue is a lower median income and yellow is higher. And we did definitely notice that we've got, like metropolitan areas, we've got much greater concentration there. And we do have areas that we don't have a lot of representation. Jackie, feel free to jump in at any time. I know I was not yet a part of the equity team when they started doing some healthcare outreach to try to reach out to areas and regions where we had less representation.
So
from
saying,
different
let me just
facilities.
break in. Are you saying that the darker blue, the yellows are representing the higher numbers
Yes.
of requests?
No, the higher median income.
Okay, so it's just
So the little
just
dots are the
income
facilities.
Okay.
So if you see these the orange dots that, now that I'm looking at it here, don't show up as well as they did on my other screen, but you can see these little dots are the facilities that have requested stuff for us. So those are the facilities that we've got mapped onto here, and so that's where you can see kind of this greater concentration in more city centers and metropolitan areas, and the darker blue is lower median income. And so those are areas that we're also concerned about, that we want to make sure that we are covering, maybe because they haven't heard about us. So we're actively doing outreach to different facilities. Let's see, this is our list of healthcare outreach that we're doing. These are the facility types and communities that we want to reach to make sure that they're also included in our in the facilities that we're reaching in terms of donating PPE. for each one of these, the way that we're approaching this project is for each one of these either facility types or populations, we are identifying between like 5 and 7 risk factors and mapping those risk factors and identifying regions of higher risk and lower request concentration so that we can reach out to those facilities and actively, you know, hopefully get their PPE needs, record those and get those filled for them. So we are doing that by facility type. So because, you know, there are different risk factors for different types of facilities or for different populations that we want to reach out to.
I'll jump in and
Please do.
Go back to the last slide just to give some backstory on what was happening on the ground. And as I mentioned, the first couple months were just like kind of crazy grassroots mobilization and just trying to get PPE out the door to make a dink on the shortages across the nation. In that process, we were intentional about collecting some of that data by location, getting the type of facility, whether or not they're serving medical clients. And in the meantime, we had a group of people and volunteers doing research, pulling this data about where the underserved are, where are the COVID cases and deaths happening. It took a couple of months of us in emergency response mode while capacity building to get to this point where we could actually reflect and look on the data. So what we found was actually what Joanna pointed out, which is that there's a lot of facilities that are making requests in the metropolitan areas, but what is more telling is what is not shown in here, which is the facilities that are in lower socioeconomic status areas and with higher COVID prevalence rates or fatality rates that weren't making requests. And that is likely what happens a lot in healthcare access and access to resources is that those who already have access or are well connected to networks of resources are the ones that get it. So, and we saw this manifest at the local level as well as on the regional and national level. So we made an intentional shift starting in, I think like March, April was when we started gaining momentum and having these conversations. Sorry, not March, April, May was when we started having these conversations and really trying to pull these pieces together and running these analysis. The data emerging across all of the different local affiliates and different data sources was especially challenging. So all of the techie people that came out of the woodworks across the nation really helped us out, get to the point where we could have this data to look at. So the gaps that we found was that there are places that are just missed. They're not hearing about GetUsPPE. We also merged our data with Find Masks, which is a really big database that other facilities were entering into. So it's probably the closest, I think, to comprehensive representation of requests for PPE from healthcare facilities. And this includes hospitals, clinics, nursing care facilities. We also opened it up more recently and in collaboration with Find Masks and Project N95 to other non-healthcare facilities like homeless shelters or skilled nursing facilities, I guess just still healthcare facilities. Yeah. But I think one of the a couple of key takeaways is that the demand data didn't necessarily reflect where the greatest needs are. And in the meantime, the national trends, we were constantly looking at the latest research and studies was showing that it was very clear those who were disproportionately impacted historically were compounded by COVID and having higher fatality and morbidity rates. So pulling all of this together, we made a couple of intentional pivots internally at GetUsPPE to address these gaps, and one of which is the healthcare facility or the outreach efforts that we're having a huge group of awesome volunteers who are helping to do outreach. So what we did was we overlaid the data, the demand data with COVID cases and fatality rates, and took a look at where were the locations where they're most vulnerable based on a vulnerability index called the COVID Community Vulnerability Index, where are the highest deaths happening from COVID. Oh, yeah, that one. And where are we not getting requests? Because logically, if they have a lot of health inequities, existing health inequities, and there are a lot of cases of COVID, their hospitals are probably overwhelmed. And what we were hearing from the ground is that some of the facilities were just so overwhelmed and so overworked, they didn't have the capacity to seek out these extra resources.
Yeah, this is great views. So we had a couple questions come in. So when you look at this data, do you have a sense around why the demand data, like what are your guys' takeaways around why they're not, why we're not seeing those needs? Like, do you think it has to do with, is there anything about internet access? Is it just the function of human networks? Is it,
I could take a stab, Joanna, and you can let me know or add on.
I'll add on.
All of the above. Kind of, there has been a plethora of research and evidence showing that certain communities have experienced systematic disadvantages to accessing healthcare resources. And by resources, I mean like even internet in some cases, healthcare workers, doctors and nurses, funding, having the equipment that they need, having the training and skills that they need to fill gaps. All of those contribute to kind of the perfect storm with COVID, where whatever caused them any barriers during a normal day to access resources were super amplified during COVID. So I think also the networks from which a lot of the hospitals and that were involved in GetUsPPE, as well as the maker movements and these mobilization efforts, was around well-resourced areas, which is a lot of times in the metropolitan city areas.
Great. Okay. Yeah, Dorothy makes a good comment there in the chat that some communities like Navajo Nation, even basic needs weren't being met, like access to water for hand sanitation.
I think what we're seeing, just to add on to what Jackie said, is that, you know, we're familiar with all the systems in place that lead to communities being higher risk and underserved. And it's really just as a compression of what we know as like the political, social, and economic systems that are in place that lead to this situation. And it's fully compounded, like we're just seeing it so clearly with COVID cases and morbidity and mortality rates. And yeah, it's the stuff like the facilities and the geographic regions that we're missing are a reflection of that as well.
Right. Okay, well, let's pivot for a moment to some of the work that's been done on the ground with Rachel and Ace Monster Toys, and take a look from the point of view of a community maker situation where you know, what are some of the ways that from a makerspace point of view or a PPE production point of view, these people in the community might approach or have approached thinking about equity and distribution from some of these. So Rachel, maybe I think you have some slides and some info to share.
I do. I'm gonna screen share. Can everybody see that presentation? It doesn't tell me if it came on over. Fantastic. So really the things that I want to talk about today are kind of philosophies and approaches to this problem from a local level, and how local projects can create relationships with existing social support organizations and really think and make socially relevant products from end to end, from your first desire to help to actually PPE getting to people. So that's kind of what I'm here to talk about today. I'm going to echo many of the themes that have been introduced by Jacqueline and Joanna. And without further ado, so your first step locally is research the needs. Whether you're in a rural area or a major metropolitan area, your local public health agencies are going to start being able to feed you data at this point in the COVID adventure. Back at the beginning, this data might not have been available, but that isn't the truth anymore. So this is the new order. What I'm showing here is Alameda County by zip code, and I can clearly see on this map where the most COVID cases are, therefore the folks most likely to be under-resourced. And they were under-resourced before all this hit, and the amplification, as Jacqueline and Joanna has said, is really here and really apparent. Who has access to healthcare and who can quarantine and still make a living matters most when it comes to whether or not they can prevent the spread of the virus or address it in a meaningful way. And if you're looking to find out where those needs are locally, use local data and start that question. So ask yourself, if that's where the most cases are, who lives there? What agencies exist there? Start with some critical thinking around those kinds of things. Consider the racial makeup of that area, the ethnic differences. Is it an immigrant community? Do they speak English as a first language? All of these things are the things you need to think about when you start looking at maps like this. And then you have to make a choice about your recipients. At the end of the day, any of us in the PPE distribution, especially for free existence, whether we're making it, whether we're in charge of coordinating distribution, are making a choice. And even if that choice is to be part of a particular product or project that distributes to a particular segment, you're making a choice about where your PPE goes. So make that choice mindfully. Put some thought into it. Consider and do some research and some critical thinking, like how many masks does a frontline worker who can't afford to stay at home need to get through a 40-hour work week? Because one is not going to cut it, even if it's reusable. Do they need shields? How will unhoused people wash a reusable mask? How will they wash their hands? Are your recipients going to be children? Are they going to be kids who couldn't go to school anymore? What are the cultural considerations for your recipients? In a lot of Latin cultures, wearing a pink mask is going to be a burden for a man, and he's unlikely to do it, especially if it's very traditional. So think about those considerations and what they might feel good about wearing, and also think about racial equity factors. It's a big deal here in Oakland, California, to ensure that the Black men who are walking around have really fun masks, so they're not perceived as a threat. And they never were, but our society's messed up that way, and you have to really work with it and make sure that people are protected. So those are some considerations about your recipients, and use that critical thinking to make a choice. Once you have chosen a recipient or a couple of recipient types, you've learned about them and what their resources are, you have that information, you know what your own abilities and resources are, design the best product you can with those resources. Seriously, there's some great considerations, like making sure it can be washed and cleaned easily by the people you're giving it to, making sure that the labels have the information that people need in the languages that work for them, and that you're not distributing your information only via internet when folks might not have internet access. One of the key things that we learned about distributing to folks who are unhoused or in protest environments is that individual packaging allows for the least amount of cross-contamination and the best vector for distributing in any of those environments. We started because we were doing big community distributions with individual packaging, and we learned that it was great in protest environments, so because they weren't contaminated by, tear gas, pepper spray. Occupation also matters. A gardener is going to need more masks in a day than a delivery person. So design the best thing you can. It doesn't have to be perfect, but think about it. Put together all this data you've collected. And then the next thing for your distribution success is find out who's already serving your recipients. Generally speaking, even in rural areas, you're going to have somebody who is already doing this work. I recommend you start looking in basic municipal listings and schools. I hate recommending this, but Facebook. You're going to find folks in social media, and really connect with folks who already have a distribution network, and they already have reputations of trust in the communities they serve. And that's super important when you're putting out protective gear. And you're likely, if you make those connections, to make it possible to get your PPE out more equitably, more quickly. And then if you can't connect with an org, when you're doing self-distribution, keep it super simple and start really small, especially when you're going into communities that you're not part of. And always walk in with respect. Next slide. The next thing is all about creating those relationships now that you found out who to create them with. And I really recommend meet people where they are. Literally go to their distribution days if you possibly can. Be persistent with getting a hold of people and creating those relationships. One little phone call and one little email is not enough. And if you're expecting a whole bunch of gratitude because you're going to drop a bomb full of PPE on somebody, you need to reset your expectations. The name of the game here really is harm reduction. And I recommend being flexible and pivoting when necessary, and potentially creating safe pickup processes. And if you're doing self-distribution and you're especially in unhoused communities and camps, treat people with dignity. It's going to be a harm reduction thing in and of itself when you bring that kind of attitude to the table. And last but not least is I'm totally open to questions, but those are just some of the things that I learned. And all of this information I have published to my website, thecraftyavenger.com, so you can get this deck and you can get all my speaker notes, including expanded details. But I really wanted to honor keeping to our 5-minute limit today. So that's my presentation, and thank you so much for your time.
I'm unmuted here. Thank you, Rachel. That was great. It's so nice to see it distilled like that, and the work you've been doing here in Oakland, where I live also, has been very impactful and meaningful. And Demetrius, changing the lens to Shreveport, Louisiana. We had a conversation in preparation for this, this call. And I wondered, really enjoyed chatting with you about not only your activity, but your point of view about resilience in communities, and the complexities around thinking about PPE distribution and service, or this aspect of like aid and donations versus self-sufficiency. And I just wondered if you could share some thoughts from your point of view about how you guys were approaching this, and recommendations based on your experience there in Shreveport.
Okay, thank you. Yeah, it's definitely an interesting conversation. I mean, for us, because we have this diverse, range of resources as far as collaborating with other organizations that have a lot of knowledge and resources they bring, as well as capabilities outside our own scope as an organization, we've been able to do some very innovative things in addition to being able to provide PPE beyond the capacity our equipment actually has. We're still a newer makerspace. We've been able to team up with other organizations and businesses and get out some quantities up into the hundreds. But also we've been able to pull in some of our members, as well as people that weren't members before this, and get them active in the production side. And so, our approach towards equity and inclusion, we always like to say that we're intentional, from our board leadership to our membership on out. And then we directly started to partner with social justice organizations within the past year. So when we're talking about these gaps and disparities, it's not so much as an afterthought with a lot of businesses and organizations. It's integrated into every single program that we do. And so in terms of PPE distribution, like I say, me running a neighborhood association in one of these, what our city leaders have called hotspots, or one of our high infection rate areas in Shreveport. I kind of had that on the ground vision of what was needed. People directly from the community called me, emailed me, messaged me on Facebook, Demetrius, we need X, Y, Z. And so we really have an ear to the streets, but then we also have college educated members like myself that will actually go online and go through census data, go through research, go on the National Institute Health, website. And we kind of have a good mix of, actual scholarly research and then actual field data going into the neighborhoods where people are disadvantaged. Listening to them, whenever I'm building stakeholders, I always like to go in, like Rachel mentioned, when you're talking to people that are less fortunate and disadvantaged, sometimes there's this tendency to come in with kind of a know-it-all mindset, some of those smart people, and kind of tell the communities what they need. Even if a lot of times you can identify a lot of gaps by simply listening to your constituent. And so even though you may already have that answer ready and right here in your hand to give it to them, one thing that we make sure to do is that we, survey and also have, one-on-one conversations, or go and have like these town hall style meetings. Like we sponsor actual community meetings, neighborhood meetings, census outreach. We had a real big push for that, and we were able to talk to the residents directly and let them tell us what they saw. It was a little bit harder to do that with COVID-19, with everyone being quarantined to their homes. We obviously had to do a lot more Facebook Live and Zoom. And so that has been a challenge to us. Whereas we normally, our makerspace is kind of an in the streets kind of makerspace. We go do community outreach events all over the city. And we like to especially go directly to those underserved groups that we want to be about, so that we're having a direct relationship with them. It's been harder to do, obviously, with COVID. What kind of turned it around for us with our PPE distribution, we had this whole racial injustice thing spring up at the same time, with protests springing up where people were kind of out there anyway. And of course, they needed help. So we've been able to equip a lot of the protesters with PPE shields and masks. And that's kind of given us another way into connecting with a lot of people in the community that prior to like the Black Lives Matter protests would have been in their houses. A lot of them have limited access to internet and computers. And so whereas there really wasn't a component for bridging the digital gap when this took off, and there's layers to this. This is an onion, right? When we start talking about disparities, there's several different variables you can point to, and you're gonna see this pattern. And if you looked only at that one thing, like PPE, the internet, any one thing, you would say, well, this is the problem. But it's actually all of these little separate things are the problem. And we kind of need this strategic approach. So like we started working on bridging the digital divide last year. We actually combined that with our census outreach efforts. And we were already planning to do like this big, huge push for the 2020 census that was gonna be online for the first time. This is what we were planning last year, and actually upskilling our communities, teaching digital literacy, closing those digital gaps. So we were doing research on that side anyway. And it just so happens when the pandemic came about with COVID-19, some of these gaps and disparities that directly correlate to what we were already looking at as far as undercounted areas by the census, places with huge digital literacy and digital access gaps, they happen to be the same exact neighborhoods and target areas. So it was kind of, well, this is a slightly different subject, but it's some of the same root causes, and it's some of the same needs, some of the same communication barriers. So what we were able to do was pivot when the pandemic happened and use this research and these resources we developed for the census and digital divide and other things and even STEM education that we work with, we were able to take those same partners and those same vehicles and kind of move it and point it at the PPE production. So all I had to do was tell them who was affected by it. And, you know, these people don't have masks, they don't have shields. Some of the same people in the low income communities also make up most of our nurses and make up most of our cashiers and our frontline workers, our essential workers are our low income citizens, right? And so it was really just a matter of being able to know enough to know that when the event happened, being able to articulate the need and then quickly pull in support. And we were able to do that because we were able to build relationships with different organizations ahead of time that we already had a working relationship with. It was just a matter of making phone calls and emails. And then we could be in low income communities all over the city without us necessarily having to run all over the city. We just use our network that we already had for social engagement to distribute PPE to this organization and this organization. They would then turn around and distribute to all their people in need. So we could take care of an entire community, simply going organization to organization, and then they would do the work throughout the week of distributing shields and masks in their community. And we do the same thing in each low income community we would serve, you know, even with, you know, other organizations, schools, our hospitals. We already had relationships with some of our health and hospital workers. So again, that was just a matter of me calling people that I knew, making a donation of a couple hundred or whatnot to Willis 9 and to Oshner, to Shreveport Police Department. I couldn't imagine us having to create all of that structure that we had in the middle of the crisis. And I can say that, yeah, as someone from a low income community, a lot of these neighborhoods really don't have that. They don't have an active neighborhood association with resources that can help them out and respond. Or if they do, their neighborhood association doesn't really have tech people or even younger people that could feel comfortable quickly learning tech to be able to do some of the things that we did for these communities. So there's definitely a gap there because.
We just lost Demetrius. I think he'll find his way back. That was riveting though. Danny, you had a question and I'm hoping that it's not for Demetrius, but I'm guessing it is. I'm gonna go ahead and let you ask your question and then we can, maybe Demetrius will jump back in. You got the stage, Danny, go ahead.
Okay, hello everyone, I'm Dan Chen. So Sabrina, can I ask about the question again? So what I have to ask?
You go ahead and ask your question.
Okay, so I have a question is about how to connect the local response and the international request together. For example, that because that we are now making some PPE to the Afghanistan, but I'm thinking about how to ship to the Afghanistan, and we are also thinking about, because we are going to make some swab or the ventilator, and we are thinking about it's okay to ship to other country, and it's okay to get into this country when we ship like some medical device or medical supplies. Is how to make sure the shipping is good. And another thing is how to help the other country to set up their verification system. Because in Afghanistan, that there is not a 3D printer or Fab Lab system. So we can give them the file, but now they didn't have the verification system. So we have to make in Taiwan and ship to there. But I'm thinking about, it's okay to set up some verification system in Afghanistan or near Afghanistan. Or another thing is to ship the 3D printer to other countries, just like we can donate the 3D printer to Afghanistan and to help them to set up their own fabrication system. So that is OSMS Taiwan that we are thinking and we are now doing. And so we are 3 projects is to, one is for the 3D printer face shield, another is a 3D printer the swab, and the last one is a 3D printer ventilator. Okay, thank you, Sabrina.
No worry. Thank you very much. Yeah, Danny, I mean, this conversation that we're having is pretty specific to so far to the US. We have a conversation developing around like this question of international aid. I don't know if GetUsPPE, if either of you guys have experience or exposure to any of this international aid and or capacity building, because that was where we didn't get yet to Demetrius and the part of the conversation we had prior, which is this question of building tool capacity and production capacity, not just figuring out how to give things to underserved communities, but how are there also production capacities in those communities. But I don't know if you guys have anything to respond to Danny's question, or Rachel. Oh. Go ahead, Joanna, first.
Okay, I just so we do have some. I can't speak, unfortunately. I'm sorry, Danny, to the shipping issue. I'm not very familiar with that. Oh, yay, Demetrius is back.
Yay.
I can't speak to the shipping issue very much, but in terms of capacity building, we do have some international affiliates, and what we provide for them is a lot of web support and kind of the back end data support that they need in order to collect this information. So it's very similar to our websites. I believe we are partnered. Jackie, please jump in with any that I may have forgotten. But India, France, Australia, and I think there may be some movement for Canada, but I'm not certain. And I'm sure there are some that I've left out. I personally was hoping to work with GetUsPPE and start an international affiliate in Peru. Still trying to figure that out. But we do provide that kind of capacity building and tech development support.
Okay. Rachel, you had it. Did you have a response?
Yeah, I've actually been talking with folks a lot about this because I'm in the middle. I mean, I'm in Oakland, California. You saw our map. It's still not great. But I am in the middle of like Techlandia, like highly resourced part of the world. And a lot of our conversations relate around how ethical is it for you to be shipping things around the world in the middle of COVID? And is your product or what you're shipping in the end going to do more help than harm? And when you can create those relationships and try to reduce that burden, because sometimes international shipping is not necessarily the right thing to do. Maybe there's somewhere closer than Afghanistan to ship to, and maybe it's networking somewhere closer to Afghanistan and working with that partner. And then the other very practical answer to your question, Danny, is find an NGO that's already working in Afghanistan and partner with them, because they've already sorted out shipping. They've already sorted these things out. I'm San Francisco Bay Area again, so in my head goes Burners Without Borders. Boom, right there. They've solved this, even in COVID. Though the solution is always evolving, just like the situation. So really find an NGO that's already operating is my recommendation.
Yeah, and I can also do a little bit of outreach as well. I do want to have a follow-on Zoom about this question around international aid. I mean, but it brings it back to this issue where we're hearing around the decline in maker-generated PPE right now. People are exhausted. People have expended their time and their money and their efforts. There's definitely still a lot of production going on. I'm not going to minimize that, but we've seen the production count diminish. And some of that response is we feel like the needs are sated. And so to the extent that like that there is an opportunity to daylight more need. I wonder, we've heard about great community organizing strategies for how to go out there and make relationships to build the communication channels so that information is more naturally available. But I wonder, from the GetUsPPE point of view, you know, in terms of your strategy for daylighting more of that need, are you guys taking it? I mean, again, it's like sort of human to human work, right? It's not an algorithm that's going to do it.
Yeah, we're doing a multi-pronged approach. We are trying to incorporate, so right now we semi-automate the matching of PPE donations to facilities, and it's mainly based on trying to minimize the cost of transportation and shipping, with some consideration to geographic area and the socioeconomic status. We are also now incorporating the COVID community vulnerability index into that decision-making process, as well as other factors such as the facility type and the level of COVID prevalence in that area. So hopefully that that will then inform the decision about where a PPE donation should be going, with the idea that CCVI, the COVID community vulnerability index, captures, in addition to socioeconomic factors, is communities of color, whether or not they have high rates of chronic diseases, which we know empirically that communities of color, particularly Black, Hispanic, and tribal communities, experience disproportionately higher rates of chronic diseases, and as well as hospital capacity. With the idea that those with a higher vulnerability index should be given higher priority because they're at a more disadvantage to the impacts of COVID.
Just pulling this up to give you a visual of the different themes that are incorporated into the CCVI. There's socioeconomic, household composition, minority status and language, and housing type and transportation. Those are actually all part of the CDC's social vulnerability index, which is something that they compute and provide based on data that they collect. And the CCVI, it's not, oh, Jackie, I should know who who developed this, but I'm not remembering right now. It's not developed by the CDC, but it overlaid, as Jackie mentioned, the epidemiological issues and then health system factors. And as you can see, like, these things don't line up perfectly. So it is important to take all of them into consideration. The one like not an ideal thing about the CCVI is that it's static. So it does not take into consideration COVID infection rates or how, you know, the dynamic situation of how infection rates are changing. But it is a good resource to use. They have the indexes available by state, by county, and by census tract.
I'll also add that for the human to human factor, we work closely with the local affiliates and trust in them to know what are the needs and know their communities. I think an important step for, I think GetUsPPE's national operation is very unique in our approach. I think what is perhaps a good lesson that's more transferable is to take a look at how you are, if you're doing anything systematically in your organization or in your operations, how is racial or ethnic or social inequities built into your processes? So whether it's because of where people are hearing about the work that you're doing, that's a systematic disadvantage. Is it that if you happen to be funder or providing materials, are you providing it only to recipients that probably usually get these resources? Are you providing it to people that you're actually helping? From a funder's perspective, the best practice is really to try to find opportunities to empower the communities that you're trying to help, rather than necessarily just going to the fanciest company that can make fancy stuff and then give it to them. So that's kind of the underlying philosophy of all of our pivots and shifts. And we are also doing small grants out to makers with this intention as well.
Yeah, and your grant program has been well received and is very appreciated from the maker community. I think both these two maker leaders here have been recipients, and it's super awesome. Demetrius, we talked a little bit, and before when you jumped off, this question of building capacity also around production. Did you have any thoughts about that you wanted to share, or actually in summary, because we're rounding up on our hour, you guys, other actionable tips or recommendations you want to throw in here at the end?
Absolutely, and I'll even drop our website and our mission statement here, because we've updated it this year. We're all about democratizing technology. Our facility is also a certified Fab Lab. And so, when we talked about discussion you and I had was the back end of things, because one of the problems with, I think, underrepresented groups and disparities, the reason they continue to perpetuate is because the discussion is always on the receiving end. But we don't ever talk about building in that self-sustaining capacity where, makers are all about making things ourselves. So if we're talking about equity and inclusion just with the Makerspace resources, are we pulling people from underrepresented demographics into our maker spaces? And we talked about that in a separate conversation. Are we showing them how to produce things themselves? I can tell you in the Black community, Pan-Africanism is a big ideology from guys like Marcus Garvey, Booker T. Washington. They were all about the Black Wall Streets and us being able to produce the things that we need on our own. Cooperation Jackson is a community partner of ours in Jackson, Mississippi. They have a $600,000 Fab Lab that they fundraised for together with Lumumba Jackson Jr. And they're all about community production, which is where we asked permission, borrowed the name for our program from, community production. And so they had that, they've been running like a farming co-op since the 60s, where African Americans got together, started their own farm, their own co-op businesses. That's grown into like 20 different businesses that they run now, where they're actually producers, distributors, and makers, actually generating income to help uplift their community. They've been doing it since the 60s. So it's part of a comprehensive movement. And it's helped empower a lot of the African American citizens of Jackson, even to the point of their mayor grew up in that same movement. And so we're working on something very similar in Shreveport, and we work very closely with our African American mayor, Adrian Perkins, who's the second youngest mayor in our city history, and actually ran on a platform of digital inclusion and universal broadband. And we actually have a smart city platform. I was able to chair that committee for him and help lay out efforts like what we're talking about right now, including the micro manufacturing community production. So again, it was intentional and forward thinking. There was diversity built in from the beginning, but we already had these discussions about, like based on, I think from our Alice report in Louisiana, about 70% of our jobs here in Louisiana are from locally owned businesses. So if we're having that age-old discussion about localizing business, creating those revenue streams here at home in our own town where, we have a shortage of PPE coming from overseas, but if we have the capability to make the PPE right here in our communities, not only does that empower Black communities, and not only does that empower poorer communities, that empowers non-Black citizens and communities the same way, because that's impacting our tax base if we're exporting goods instead of importing goods. And so that's the action items that came out of that was the PPE production that we're part of with you guys. But the PPE is kind of a branch under the tree of our digital inclusion effort, which when we identified those gaps, we always do action items with all of our research that we do in our little circle of nonprofits. So our action item to help close the digital gap was partnering with our ISPs in the city to help target those areas that need some type of expansion or public-private partnership on the internet access, which we're actively working on right now with the city. But then also we've been collecting donations of computers since the pandemic closure started, and they said everybody had to work from home, go to school from home. We've been taking computer donations, refurbishing them, and then donating them to those same constituents. So they can get shields, masks, and a computer from us, and we'll help them sign up for free or low-cost internet. We're even raising money to try to get mobile hotspots. And so we, you know, in Louisiana, we like gumbo. We like to throw everything together. But we're doing that now. So that's up on our website, our computer donation program. We're training the underserved citizens. We'll bring a few of them to our space, socially distant, give them masks. They're working, we're teaching them to work on the computers with us for themselves and for their community members. So that's a work skill. And then at the same time, you know, they'll come help us put shields and masks and stuff together. So we're very much into, let us show you how we're producing this, see if we can give you some capacity to produce it. I have a couple of people from underserved communities that, you know, I've done, like, we waived membership dues in lieu of money and had them volunteer 10 hours a month. A couple of those members have started their own LLCs that we've helped them do, and they got their own businesses where they're selling the stuff that they make with us. So we're all about that type of empowerment. We put a couple of them on jobs working with the city and a couple of our sponsors. So, you know, we're looking at, while we're feeding the need of, you know, we need to donate computers, we need to donate PPE, but, you know, we're a nonprofit, we don't have capacity as a big business. It helps us and helps our constituents if we bring them in and then we're actually training them how to produce these things. Now we got a new problem where a couple of my members are coming to me now. They're doing great sales at the micro level that they're in now, but a couple of them are ready to grow. So we're already at that discussion about credit and capacity. And, you know, we may have to find them somebody that might want to, you know, do like a business pitch competition for their business. That's another level of the game that I think we definitely have an area opportunity for right now. You know, in terms of making sure that, you know, we're bringing people in on the production side as well as the recipient side. And then already identifying those barriers, just like we had with our big donation push of PPE, we ran into those capacity problems. Our makerspace doesn't have as cool a laser cutter as your makerspace. How can we get one? You know, we've had that discussion. Imagine having that discussion and you're not a nonprofit and you can't fundraise for it, and it has to come out of your paycheck and you're working at Taco Bell or McDonald's. You don't really have that type of capacity to buy the machine. I've been trying to look at ways to pitch our makerspace as a capacity tool for those communities and individuals that don't, it's not feasible for them to actually buy the equipment, but if we have it and we could set up times and things with them, even if they're not a member, can't afford a membership, we could just do it as an in-kind service, allow them use of the equipment, and we get those high capacity items, help them generate some revenue, basically like an incubator. And then once they have enough revenue coming into their business, they start to go buy their own equipment, they break off, they move out of the nest. So micro manufacturing incubator is what we started writing and brainstorming during the pandemic, because we already saw that this was going to grow into something beyond a charitable effort. But I think it can still have charitable impact if we're saying, instead of people that already have money and resources and big companies profiting off of an open source movement, why don't we just empower the people that we're trying to help anyway to become those producers and business owners, if that makes sense?
Yeah, totally. Well, that's I think a wonderful way to kind of close it out in a way, a vision of what is possible, and a vision to work towards, a future to work towards for all of us. Wendy is, I think you're laying out a landscape of work to do for a lot of makerspace organizers out there who really want to commit to developing this kind of future. But Demetrius for the win. That's great. There's a lot to talk about here. I really want to acknowledge everyone's time though, and thank all of the panelists. Thank you guys very much for participating. Thanks to the audience. We will share out the archive to the folks that registered so you guys can share it out. Please follow up in terms of your feedback and involvement in these groups. You can find us at Open Source Medical Supplies on Facebook and online, Ace Monster Toys, GetUsPPE, and NWLA Makerspace. Thank you guys so much and have a great rest of your week.